You ever get that Clark Kent feeling? Like squinting to see if that's really the bus coming or just a blur way off in the distance?
Oh, yeah, I know what you mean.
It's like glasses and contacts. They're like our superhero capes,
Oh,
right?
wait.
But maybe you're ready to, like, dish the disguise altogether. Embrace that crystal clear vision, you know?
Yeah, yeah.
That's where LASIK comes in. And in this deep dive, we're going to go beyond the hype, figure out if LASIK is really right for you. By the end of this, you'll have like all the info you need to decide, is LASIK like my vision correction soulmate? Or is it time to swipe left and explore other options?
I like that.
So before we get into the nitty gritty, let's just, what even is LASIK? Let's start with the basics.
Yeah, so LASIK stands for laser-assisted in situ keratomileusis.
Okay, easy enough. I'm just kidding. Let's break that down.
It is a mouthful, right? So basically, it's a type of laser eye surgery that reshapes your cornea, that clear front part of your eye.
Right.
It acts like a lens, and they reshape it to correct your vision. Think of it like this. The laser is like a super precise sculptor,
Okay.
delicately reshaping your cornea to help light focus exactly where it needs to be, which is on the retina at the back of your eye.
Gotcha. So no more relying on those like external lenses, glasses, or contacts to do the heavy lifting?
Exactly. But here's the thing. The reason why we even need vision correction is because of something called refractive errors.
Okay, so let's unpack that a little bit. Refractive errors. Sounds a little scary.
It sounds a lot scarier than it is.
Okay, good.
So imagine light entering your eye like a beam aimed at a target. For you to see clearly, that beam needs to hit the bullseye, which is your retina.
Right.
But sometimes the cornea or the lens inside your eye doesn't bend the light perfectly and it misses the mark.
Okay,
So that's your refractive error.
got it.
So nearsightedness, the light bends too much and it blurs distant objects.
Okay,
Farsightedness, not enough bend, close-up vision suffers.
makes sense.
And astigmatism, it's like your cornea is shaped more like a football than a basketball.
Okay,
And it blurs things at all distances.
got it. So how do we even measure how off our vision is? This is where diopters come in, right?
You got it. Diopters are simply a way to measure the severity of those refractive errors. Think of it like the strength of your glasses prescription. The higher the diopters, the stronger the correction you need. To put it into perspective, -12 diopters means your vision is way more out of whack than someone with like -2.
So it's like the difference between needing a little nudge or like a complete vision overhaul, basically.
Precisely.
Oh, got it.
And this is crucial because it plays a huge role in whether or not LASIK is even an option for you.
So let's get down to brass tacks. What are those magic numbers? What diopter ranges make someone a good candidate?
Okay, so for nearsightedness, LASIK can typically treat up to no nerve 12 diopters.
Okay.
Imagine like being able to see the TV clearly from across the room, no squinting, none of those like Coke bottle glasses.
That'll be life-changing, I bet, for a lot of people. What about other refractive errors?
For astigmatism, we're looking at up to 6 diopters, and for farsightedness, the upper limit is around +6 diopters.
Okay, so say you fall within those diopter ranges.
Yeah.
Is there more to it?
Oh yeah.
It's not an automatic you're in.
Meeting those requirements is like step 1 in the LASIK obstacle course. Another critical factor is vision stability.
Okay, so vision stability, is that like how consistently blurry your vision is?
Not exactly. It just means that your eye prescription has been stable, meaning no significant changes, for at least 12 months before even thinking about LASIK.
Okay.
This ensures that the laser vision correction you're getting is accurate and long-lasting.
Makes sense. You don't want to go through the procedure only to have your vision shift again a few months later.
Exactly. And then there's another big one, and this one's all about measurements, and that is corneal thickness.
Corneal thickness. Okay.
Yeah.
How does the thickness of my cornea factor into all of this? Yeah.
So remember, LASIK works by reshaping the cornea with a laser.
Right.
So if your cornea is too thin, there might not be enough tissue to safely reshape, which could lead to complications or less than ideal results.
So it's kind of like if you're trying to like sculpt a masterpiece out of a thin sheet of paper versus a big block of marble, you need enough material to work with.
That's a great way to put it. The average corneal thickness is between 540 and 560 micrometers, and we're talking like really, really precise measurements here.
Wow.
So if yours is thinner, LASIK might not be the best option.
This is where like those really detailed eye exams come in. You might have even heard your eye doctor mention corneal thickness before.
Exactly. Paying attention to those details and, understanding your own eye health is key.
So we've covered diopters, vision stability, corneal thickness. Those all sound like incredibly important factors.
Hmm.
Are there any other, like, pieces of the puzzle when it comes to figuring out if you're a good LASIK candidate?
Yeah, absolutely. So LASIK isn't just about like your eyes themselves, but it's about your overall health too.
Oh,
It's kind of like, would you go for a run with a sprained ankle?
definitely not.
No. So we're talking about being in good shape to bounce back from the procedure.
So are we talking, like, marathon runner level fitness or just generally healthy?
It's more about your body's ability to like heal and recover efficiently.
Okay.
You know, your doctor will want to know about things like diabetes, autoimmune disorders, any medications you're on that might interfere with healing.
Got it. So full transparency with your doctor about any health conditions or medications is key.
Absolutely, yeah. And speaking of health, we can't forget about the stars of the show.
Yeah.
Your eyes. They
Right.
need to be in tip-top shape too.
So, like, no hiding that nagging dry eye or like a lingering infection.
Exactly. Conditions like chronic dry eye or any active eye infection, those need to be addressed before even considering LASIK. You want to pave the road before you start driving on it. Got to have a smooth surface for like optimal results.
Makes sense, yeah. You wouldn't want to, like, fix one thing only to have something else cause a problem down the road.
Right. And this one might seem obvious, but age plays a role too.
Okay, so beyond just being over 18, because we touched on that earlier.
Right. So remember how we were talking about vision stability?
Right.
Well, that often comes with age. You know, our eyes tend to change more when we're younger. So most eye doctors recommend waiting until at least your mid-20s, sometimes even later, for LASIK.
Okay.
And that's because by then, your vision is more likely to have stabilized, which leads to better and longer lasting results.
So it's all about, like, finding that sweet spot where your eyes are, like, mature enough, but, like, before other age-related eye issues might start to crop up.
Yeah, that's a good way to put it.
Oh, yeah?
So we've covered a lot of ground about, who might be a good candidate, but let's like flip the script a little bit.
Okay.
Who should be like pumping the brakes on this and exploring other options?
Yeah, let's talk about who might want to think twice before going under the laser.
Okay. Because as with any medical procedure, LASIK isn't for everyone. So let's start with the most obvious, like anyone under 18. As we just discussed, younger eyes are still changing, they're still developing.
Right.
So LASIK is not recommended.
Definitely not a birthday present you want to be asking for.
Right, exactly. And we can't forget about pregnancy and nursing. Hormone fluctuations during those times can cause temporary vision changes.
Oh, wow.
So LASIK is typically put on hold until, things settle down a little bit.
Makes sense. You want to make sure that you're working with your real vision, not like just a temporary blip.
Exactly. And then there are certain medications, like steroids, for example. These
Okay.
can interfere with LASIK results and healing.
So again, full transparency with your doctor about any medications you're taking.
Yes, 100%. And, LASIK is amazing for a lot of people, but some specific health conditions might make it riskier or less effective.
Okay, so we're talking about things that could, like, impact how your body heals from the procedure.
Exactly. Uncontrolled diabetes, autoimmune diseases like rheumatoid arthritis or lupus,
No.
even other eye conditions like glaucoma or cataracts. These all fall into that category.
So it's not just about whether or not you're, like, a good candidate for LASIK, but whether LASIK is the right choice for you and, like, your own, health and circumstances.
Precisely. And here's an interesting one that people might not expect. Pupil size?
Pupil size. Okay, so why would that matter?
So if your pupils tend to get really large in low light, it can sometimes interfere with the way light enters the eye after LASIK. And this might lead to glare, halos, or difficulty seeing clearly at night.
Wow, who knew? Pupil size. That's why we do these deep dives, right? Uncovering all those, like, little hidden details. So wow, it sounds like LASIK is a pretty major decision.
Yeah.
Like, a lot of factors to weigh, It's definitely not one size fits all.
You hit the nail on the head. It's about finding the right fit for you and, like, your unique eyes.
Right.
What works for one person might not be the best choice for someone else.
Totally. So that kind of brings us to, like, the million-dollar question.
Yeah.
What's the next step for our listeners who are, like, intrigued but want to make sure LASIK is the right call for them?
The most important step is scheduling, like a really comprehensive LASIK consultation
Right.
with a qualified eye surgeon.
So this isn't your, like, typical quick eye exam.
No, this is way more in depth.
Okay, so what can someone expect during a consultation like that? Like, what actually goes down in that appointment?
They're gonna, they'll do a really thorough eye exam.
Okay.
They'll measure your corneal thickness, map your eye's surface. They'll even look at your tear production,
Wow.
basically checking how well your eyes stay lubricated. Think of it as like getting every nook and cranny of your eye analyzed to determine if LASIK is even like a safe and viable option.
So intense, but like in a good way. Like they're really leaving no stone unturned.
Exactly. And don't be afraid to like come armed with questions.
Right.
The more that you understand about your own eyes, the more confident you're going to feel about your decision. Knowledge is power.
100%. And hey, even if LASIK isn't the right fit, like there are other vision correction options out there. We've got glasses, contacts, PRK, that's another kind of laser eye surgery. There's implantable lenses, like there's options.
Yeah, so many ways to achieve clearer vision. And a
Exactly.
good eye doctor will help you, figure out which ones are best for you.
We've covered so much ground today, from like the actual science behind LASIK to, those make or break requirements, even like alternative options.
Oh,
As we kind of wrap up this deep dive into the world of LASIK, I want to leave you with this.
yeah,
Technology, it just keeps evolving, right?
it really does.
Imagine what vision correction might look like 5, 10, 20 years from now. Like, it's kind of mind-blowing to think about.
I know, it's pretty exciting.
So as you're weighing your options, just think about this. Is LASIK something I need to explore right now? Or could, like waiting for future advancements, could that be a factor in my decision? It's something to ponder, as you navigate the world of clearer vision.
It really is. The future of vision correction is looking bright.
It really is. Okay, that's it for this deep dive. Be sure to check back next time when we, take on a brand new topic.